There is an emerging trend in my office. With UroChannel becoming larger, I increasingly treat patients suffering from the consequences of faulty health advice on YouTube. I have uploaded a couple of videos on the risks involved with jelqing and other do-it-yourself penile enlargement techniques, as well as Kegel exercises. As cheap as these methods may be, treating the complications is not. In this video, I explain why it is not a good idea to do Kegel exercises for most of you. There are exceptions, but the overwhelming majority of men who want to boost their sexual performance are at risk of harming themselves more than they gain from it. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. Anatomically, the pelvic floor is a complicated group of muscles. It consists of different layers of muscle that coordinate various tasks. First of all, the pelvic floor supports the lower end of the upper body. Without it, the organs would just fall out. This also means that the organs press down on the pelvic floor. The more body weight you have, the more strain there will be on the pelvic floor, because the extra kilos from fat are heavy. The pelvic floor has to coordinate the upper and lower body. It has branches up to the diaphragm and is connected to breathing. It plays an important role in defecation and urination and is heavily involved in sexual function. Sometimes it has to relax, other times it has to contract. Therefore, it is easily disturbed in its function. This can be caused by anything: a hip problem, a leg that's shorter than the other, changed body statics due to sitting most of the day, or even stress. Either way, the pelvic floor muscles can easily end up in a state of permanent contraction. You may know this from the muscles in your shoulders and neck. When the pelvic floor becomes overactive, it may start to compress the internal pudendal artery, which is located in the small pelvis. This artery is very important since it carries blood into the penis for erections. Any compression will restrict blood flow, making it difficult for the penis to erect. There are two small muscles attached to the penis. The bulbospongiosus muscle is partly wrapped around the cavernous bodies. You know this muscle from squeezing after urination. It evacuates the last drops of urine from the urethra. The ischiocavernosus muscle is positioned laterally next to the bulbospongiosus muscle. When they contract, erections get firmer. I think you know that from own experience. Any overactivity in this area will result in a shortened muscle with little contractile ability because it is partially contracted already. Also, this will result in less firm erections. Now you start to do your Kegels because you think your muscles are weak and could use some strength. Here's the problem. Most likely, your erectile issues will get worse because now you are making these muscles contract even more. Instead, you should practice relaxation exercises to regain the full functional length of your muscles. Don't get me wrong, some men should do Kegel exercises, but typically, it is not those who want to make already great erections superb. Advanced age and radical prostatectomy for prostate cancer are typical scenarios where pelvic floor training is beneficial. I examine many patients every day and find far more cases of overactivity than underactivity. So if you want to start anything with your pelvic floor, it would be a smart move to consult a pelvic floor therapist first to get a base assessment. How do I treat an overactive pelvic floor in my office? With shock waves. If you don't know what shock waves are, this video will explain it all. Thanks for watching. Bye-bye.